When we think about longevity or optimization of us as a human, it's really based off of these core neurological functions. And one of the core neurological functions is the ability to stand on 2 feet in gravity and to be bipedal. A lot of the movement patterns that we have are actually reflexes within the spine.
Mm.
That's how integrated and critical human movement is to living. To move is to live. And to live a long time, you have to keep moving.
Welcome to Take Back My Brain with Laurie Hammer, where real healing starts in the brain. I'm Laurie, a functional nutritionist and mom who's walked the path from anxiety and burnout to clarity and calm. Each week, we're going to dive into brain-based tools like amino acid therapy, gut health, fasting, and faith to help you reclaim your energy, emotions, and sense of self. Hello and welcome back. Today, I am excited because I have never covered this topic before. And so I have with me today Dr. Emily Splichal. Dr. Emily Splichal, who is a functional podiatrist. She is a movement specialist. She's been a ballroom dancer. And let me tell you, this lady is living it to lead it. Like she does the lifestyle. And so I cannot wait to dive into this foot brain connection and movement and all those things. So you are in for a treat. Dr. Emily, thanks for being on today.
Of course. Thank you. I am so excited for our conversation.
Yes, I think feet are so important, and yet we're so mean to them. Like, how
Yes.
many people are really taking good care of their feet out there? I would love to know, like, how did you get into functional podiatry for one? Because I don't think most people are like, really a functional podiatrist? How
Yeah.
does that work?
Yeah.
So give us your story and then let's talk about how we can be kinder to our feet and how that affects our brain.
Yeah. No, absolutely. And yes, the feet are highly, highly underappreciated and prioritized, I would say. Until we get foot pain, then we
And we're
prioritize it.
completely focused on those. Yes.
Yes, exactly. But my passion and my journey into podiatry or feet actually started within the fitness industry and the movement side,
Amazing.
which will make sense because that's the thread through everything that I do. And as I went through podiatry school, I actually started to see very early on that it was a isolated patient sitting in the chair perspective, and it was very counter to my background in fitness, which again was movement. And I started to question a lot of what was being told to me. Podiatry is also, unfortunately, very, very highly surgical based. So I was trained as a surgeon. I did surgery outside of residency for 5 years. I understand how podiatrists as surgeons think. However, the body is very interconnected. There are a lot of options. Every surgery, even the most minor surgery, has its risks. And I've seen a lot of those risks and kind of the complications come to life where it was kind of said as just this routine thing. And of course, there's complications. So I really started to bring my passion for integrated movement into podiatry really from the beginning when I saw the isolated approach. 1 year into residency, I actually left, went back to school, got
Mm.
my master's in human movement, and then, of course, went back to residency so I could get licensed. But that couple years where I stepped out to get this really deep integrated dive into barefoot science, fascial, diaphragm, breath, pelvic floor, that whole focus as soon as I came out of residency was okay, this is how I can connect my appreciation for movement with my medical degree, knowing that we are integrated. So I consider myself a podiatrist, but I don't treat feet, I treat movement. Yes, I treat a human, but I treat movement. I'm a movement specialist.
And I love that because everybody moves, or we should all be moving. And so if you cannot move correctly, there's a lot of other things that happen. So a lot of people are focusing on their hip pain when it very might be that the fact that they have an issue with their big toe or something like that in their feet. So can you start connecting some of those dots for people?
Yes. So, what I would say to really appreciate this, the foundational movement pattern that we do every day is walking. So, if I can get my patients and all the listeners to think of that foundational movement, and when we think about longevity or optimization of us as a human. It's really based off of these core neurological functions. And one of the core neurological functions is the ability to stand on 2 feet in gravity and to be bipedal. So, a lot of the movement patterns that we have are actually reflexes within the spine. That's how integrated and critical human movement is to living, right? To move is to live. And to live a long time, you have to keep moving. You never, never want to stop moving. So, a lot of that foundational component, just thinking about walking, is yes, you have to be able to move your big toe. Why that's important is to walk the right way, you have to take long steps. To take a long step, you need to be able to move the big toe. However, you also have to be able to balance on one leg. If you don't have the capacity to stand on one leg, you cannot take a long step. If you cannot take a long step, you cannot walk fast. If you do not walk fast enough, you do not activate the circulatory pump from your feet all the way to your brain. And that's how you stimulate brain derived neural growth factor from a circulatory perspective, from a movement perspective. So, very, very powerful, connected. The demands of how we control walking is a neurological response. It's biomechanical, but it's neurological. And we need to appreciate both of those components.
Right. So are you saying if we don't walk well, we're going to age faster?
I'm not saying that, the research says that. I'm sharing the research. But
Yes.
yes, it is demonstrated that the speed at which you walk. Now, speed can be extrapolated from, like I said, step length, but it's also things like arm swing. And when you swing
Mm,
your arm, your T spine rotates. When your T spine rotates, your pelvis rotates. And it's really this spirality of the human body, of our fascial tissue and our skeletal system, that is what is hydrating and kind of bringing that fluid and that stimulation and that fascial hydration through the system. So, yes, speed will tell you a lot about this spirality. Of course, it's visually. But as soon as someone stops moving spirally when they walk, they inherently are walking slower.
right. Well, that makes sense. I think of like the Parkinson shuffle and, as
Mhm.
an 80-year-old who has a walker and they're just doing this and it doesn't seem like, they're not getting that BDNF
They
going
are
on
not.
in their brain. So no fertilizer there, so their brain cannot recover.
Correct.
So fun. So I'm 52 and I'm a fast walker. So I feel like I've got that down. So
Yeah.
that's a good thing. But as we are aging, transitioning into menopause, sometimes my feet hurt. And I'm like, what the heck is going on with my feet? Stand for a while cooking in the kitchen. And all of a sudden I realize I don't think the pads of my feet are quite as cushy as they used to be.
Yeah.
Can you address that?
There are uh, quite a few changes that can happen in the feet as a woman goes through menopause, the different stages of menopause. And of course, we know that the number one hormone that's going down during that period is estrogen. And
Yes.
estrogen is deeply connected to our collagen, not just the skin, but all of our connective tissue. So, a lot of the ligaments and the tendons, the blood vessels that supply the nerves. So, we can start to get things like neuropathy. So, there is a menopause related neuropathy or a neuritis. You can get fat pad atrophy as you go through menopause. You can start to get arches that fall, or just the ligamentous integrity of the foot starts
Mm.
to weaken, which means the feet get tired faster. That travels all the way up to the skeletal system, which means maybe the low back, maybe the knee, maybe the SI joint. Everything starts to become connected based off of our foot posture. But yes, there are a lot of changes that happen for women as their hormones are changing. And I try to, one, bring an awareness to that. And then two, how do we anticipate it? I know you appreciate this in your practice as well, is that anticipating changes in the human body is way easier to navigate than reactive. So reactive medicine is much harder to to navigate than preventive or anticipatory medicine, which is why I'm really into educating and have people know that there's these changes. Also, a lot of people will not speak about, let's say, a menopause related neuropathy. I almost guarantee a lot of gynecologists are not talking to their patients about that. And that's unfortunate, because then the woman is left to think that she's kind of going crazy a little bit, that she's not feeling these things. And it's
Yeah.
not really fair to just throw things in the bucket and say, well, it's menopause, there's lots of things.
Right. Because then you do feel like you're crazy and you're like, well, there's nothing I can do about it when there are definitely things that let's talk about that proactive piece. As we're aging, what can we do to, love our feet?
Yes, so absolutely. So there's a few things that I recommend that everyone do every day. This is not just women going through menopause. This is everyone, all ages. Is one, stimulate your feet. So stimulate the thousands of nerves in the bottom of the feet. It could be by being barefoot, going around your home barefoot, going outside in the grass barefoot. You get the bonus of earthing and grounding by doing that. I'm the founder of a company called Menopause, and we have these sensory-based products. So we have a foot release tool that is tactile. So you are stimulating the nerves that way, wearing minimal shoes, doing Pilates and yoga. So you're doing barefoot practices or exercises. So that's a really, really important one. Second one is to train the muscles in your feet just like you train any other part of your body. You have 26 muscles in the bottom of each foot, and those muscles play a really important role in standing, but also walking and the absorption of impact forces. So, an impact forces is energy. So, efficient movement is based off of those muscles. So, doing things like short foot, forward lean, balance exercises, all of those things actually strengthen your feet. So that's the second one. I would say a third one would be to understand your foot type. So flat feet, high arch, and then understand some basics on how to set your base. So just what does a proper foot posture feel like? And I teach people how to set their base. And then how does that affect the rest of the body? Right. So we have to kind of recalibrate how we talk to gravity. And no one teaches us when we're like little babies learning to stand. You're just like, stand, right? You're not like lift into gravity and lift the pelvic floor and push
Right.
your toes down, right? You just want the child to stand. And then their nervous system figures out a way. And that's one thing that's fascinating about our nervous system is that it will find a way. We are based off of survival. We are all about organisms or survival. So your nervous system will figure out a way for you to stand and for you to walk. Your posture might look very janky, off, compensated, but you are standing, you are vertical, and you are somehow getting from point A to point B. Now, the amount of stress and load and compensation in that process is individualized, and our goal is to minimize the stress as much as we can because that's created along that longevity. The least amount of stress, the most efficiency, the most ease at which you stand and move, that supports movement longevity.
Hey, friend, just a quick break to remind you if calming your brain is the missing piece in your practice or in your home, my Mind Thrive certification course teaches you exactly how to do that with targeted amino acid therapy. So it's real science, real results, no band aids. Enrollment is now open. Link is in the show notes. So back to the show.
We
Yes.
do.
And
Yes.
we have to think about our feet, our posture. And I love the fact that you talked about grounding and the pelvic floor and going barefoot. My little babies, they're barefoot all the time, right? And so when they put their little shoes on, they kind of like don't know what to do with them. But I go barefoot as much as possible. I walk outside as much as possible. I teach my clients all of those things because it's the proprioception, it's the signals from the feet to the brain that are so, so, so important. And then what do we do with I feel like it's an epidemic right now. Everybody, not everybody, that's an overexaggeration, but a lot of people are getting these knee replacements and the hip replacements. And not that those aren't necessarily needed in some circumstances, but how does that change how your body is perceiving, walking and dancing and just normal life stuff because all of a sudden we have this artificial knee or hip and that's a completely different signal. So how does that affect our feet or how's the feet affecting the knees or do you understand what I'm saying? Like how is that all connected because there's so many more lately.
Yeah. So there's obviously a very deep correlation between foot posture, foot movements, and every time you move your foot, your leg rotates. So the knee will actually collapse in or the hip will internally rotate. So this is where you do see an influence on that. Now, Of course, the number one reason for knee replacement and a hip replacement is osteoarthritis or some arthritis. Oftentimes it's osteo, a degenerative joint disease. Yes, there's a genetic predisposition for certain types of arthritis, but a big contribution to it, which accelerates the rate of that degenerative joint disease, is improper skeletal alignment and overload of stress, which was kind of what I was talking about, right? Poor joint alignment. If your joints are not aligned, you're going to wear down the cartilage faster than you should. This is in the big toe, the ankle, the knee, and the hip. Those are the big ones in the lower extremity. So let's say you've already done that. It's too late. So you got the joint replacement, right?
Mhm.
Is now just replacing the joint does not mean that the skeletal alignment is now set. What
Mhm.
you've done is you've taken away the natural joint surfaces that have nerve endings and you've replaced it with inert objects that have no nerves. So the awareness and the perception of joint alignment and joint optimization is going to be less. So again, you still could be moving with high joint load, but your joint load is on a titanium head, so you don't feel it, right? I'm
Mhm.
very much into post joint replacement, doing a lot of proprioceptive stimuli to the joint capsule, because the joint capsule, which has the thousands of nerve endings, that is essentially sensing the stretch and the position of the joint it's helping, is going to feed into the nervous system and help you skeletally try to maintain as much alignment and essentially dynamic stabilization. So you still have to be doing that. You have to think of it not just as I'm doing a joint replacement to take away pain. And if I do that and my pain is gone, check, right? No, we still need high joint awareness. We need fast stabilization. We need good mobility. We need good strength around the joint. We need to think about the foot that possibly contributed
Do
to
that.
the improper joint loading in the first place, because you don't want to get the other side done at some point either, because you're compensating. One interesting thing that I think a lot of people don't realize is post joint replacement, you can actually get these surgical limb length discrepancies. So it's something that I always look for in my patients is if you have a knee or a hip done, is to really look and make sure that you are now symmetrical,
Mm.
because the fact of adding in the joint and you're cutting away bone to essentially make room for the implant, you can start to shorten by, you know, half a centimeter, it's 5 millimeter, right? That's enough to then cause an obliquity in the skeletal system. So just post replacement, get a really good, thorough postural assessment. See a functional podiatrist, see, a chiropractor, or a functional physical therapist, someone who can assess skeletally how you are aligned. And then if there's any asymmetries, to try to balance those out.
Yeah, I love that. Let's dive into shoes.
Okay.
Can you wear any shoe? Does it matter what kind of shoe you wear? Can you ruin your feet by wearing bad shoes?
Well, yes. Yes, yes. All of it. Yes. So, you had already shared that there's thousands of nerves in the skin and the bottom of the feet. You mentioned that briefly. And these thousands of nerves need to be stimulated when we stand and when we walk. They actually talk to your brain and tell you about the surface you're walking on, about the degree and acceleration of impacts coming in. It's part of how you stabilize and you load during dynamic movement, as you feel the ground. Okay, so we appreciate that. Now you put a lot of cushion under your foot, cushion in a shoe. Well, the cushion is going to take away that information. But if you need that information to create a movement pattern, what are you going to do? Right. So you are going to move less optimally. Will you still be able to move? Yes, because your nervous system will find a way. Again, is it optimal with minimal joint stress and high postural alignment and stabilization and efficiency and fascial loading and cognitive stimulation?
Many things.
No, but you will be moving. So, research has shown that chronic use of supportive and cushioned shoes will cause an atrophy and a denervation of the foot muscles. Again, the 26 muscles in the bottom of the foot. Those 26 muscles in the bottom of the foot fascially run into your pelvic floor, the base of your pelvis, just how you stabilize your hip joints. It runs into your diaphragm, which controls how you breathe. It runs up your neck to your tongue. So there's a there's a powerful skeletal fascial stabilization sequence that happens by contracting those foot muscles. So if we make them weaker by wearing supportive and cushioned shoes, you've now destabilized potentially pelvic floor, diaphragm, up, neck, tongue. So you have airway, you have breathing, pelvic stabilization, hip stabilization, foot stabilization. You
It
see a lot.
affects everything.
It does. It does.
Yes. Yeah, even your tongue, people, even your tongue. So, are you talking like barefoot shoes or what is going to be the best option?
Yes. So ideally, something that has minimal support and minimal cushion. Now, there's a spectrum of how you could go on that, right? There's maximal shoes and then there's completely barefoot minimal shoes. Every foot type, foot strength, injury history, or activity that you're using the shoes for will fall somewhere along that, right? Should every single foot for every single activity be completely as barefoot as possible? Well, no, because there's the complexity of the human foot and injury history, etc. But where do we fall within this to try to get as minimal as our foot can tolerate at that given moment and for the activity that you're doing? Where this will make sense is, let's say if you have flat feet or fallen arches and you are a nurse and you stand on hospital floors for 12 hours straight. I'm not going to have you in a barefoot shoe, right? We're
Yeah.
going to go over in this direction. But when you are not at the hospital, you are going to, let's say, if you go to the gym, I'm going to try to get you into those minimal shoes. I'm going to teach you how to release your feet and how to find a neutral position and how to strengthen your foot muscles so that we're kind of finding that balance between both. So that's how I try to work with patients to understand the activity, again, the foot type and the injury history. Something like plantar fasciitis is going to change the conversation of how I can guide someone to shoes based off of where they are in that story of plantar fasciitis.
Right. What is plantar fasciitis?
Plantar fasciitis is a overload of the plantar fascia, which is on the bottom of the foot. So your plantar fascia, thick band of tissue on the bottom of the foot, it starts in the heel and it goes across the bottom of the foot. It does not hold your arch up. So that is a common misconception. It does not support the arch. But as it crosses the bottom of the foot into the arch, it splits into 5 pieces and it goes into all 5 toes.
Okay.
The way that we use it dynamically is every time we step or run or jump, whatever we do, we have arch compression. So as your arch drops, you stretch the plantar fascia, and the stretching of your plantar fascia is potentiating it. You're putting energy, kind of like a bow and arrow or a rubber band, right? You're potentiating it, and then you're going to recoil, and that's how you release energy. As you arch compress, if you have dehydrated, a little bit stiffer, you don't have enough rubber band effect in your plantar fascia, and you arch, compress, and you stretch, you can start to micro tear your fascia. So it is a injury, micro tear injury to the fibers that creates the initial itis, plantar
Mhm.
fasciitis, and then the body creates a repair response to it, which if it's not navigated the right way, then it starts to essentially perpetuate, and then you get stuck in the cycle of injury repair, injury repair, injury repair, and you just can't get out of it. My practice, I specialize in chronic plantar fascial symptoms, and I get the patient out of that.
That cycle. Yeah. I've never had it, but I heard that it's super, super painful.
You don't want it.
No, sure I don't. What I'm going back to shoes. Are there shoes that can trigger that plantar fasciitis, or is that something different?
So let's say where I could see a patient get plantar fasciitis is, let's say you have a higher arch, because I don't want to just talk about flat feet. Let's say you have a higher arched foot, and higher
Mhm.
arched feet are a little bit stiffer. And let's say you wore the minimal shoes, so like a really flat shoe, and you did something that overloaded your tissue. You went to Disneyland.
Mhm. Okay.
So you're on your feet and you have this unusual high load and stress. And because of your foot type and the shoe combination, you are not able to tolerate that level of stress. So eventually the load and the load and the load of the plantar fascia just fatigued and you
Mhm.
might for it.
Interesting. What about shoes that, like, squish your toes all the time?
Yeah. So we spoke a lot about the cushion and
Yes.
kind of the structure of it. The toe box shape is the whole other conversation. And the shape of the toe box can have an influence on toe alignment.
Mhm.
Now, when we think about the foot and balance and push off, so like when you're taking a step, your toes are really, really important for optimizing foot function and just human movement. So, what I often will say is really the strength and the power of the human foot lies in the toes. It's all about the toes. I know I spoke a lot about the arch, but it's actually everything in the toes. So when you squish the toes, thinking like a stiletto or even just be like
Shoe?
a men's loafer, a ballet flat, right? So it's not just stilettos, but it could be a ballet flat, it could be a soccer cleat, it could be an ice skate, I do ballroom. It could be a ballroom shoe, which does squish the foot, right? So there's different things, right, that start to have an effect on the foot. So that is going to shift the optimal toe position. That can start to cause compression in the front of the foot. That causes neuromas, bunions, hammer toes. That can lead to metatarsalgia. That can lead to stress fractures. Technically, it could lead to plantar fasciitis. So we want to always think toes are designed to be long, straight, wide, and flat on the ground, and you want shoes, ideally, that can accommodate that.
Gotcha. Yeah. I've never liked wearing, little pointy shoes and those kind of things, but even like my tennis shoes, my little pinky just kind of comes in a little bit. And I'm like, so I was just buying new hiking shoes because I'm going to the Dolomites in Italy to hike for 12 days. And thankfully I got a wide toe box, but they're kind of cushiony. And then I was like, what do I do? Do I find it barefoot? But I don't usually hike barefoot. And so
Mhm.
I don't know.
Yeah. So what I would say on that one, again, I'd mentioned my company Nabosa, but we have sensory insoles. So what I will tell patients is if you are going to be in a thick cushioned shoe, and that's the reality of the situation, right? How do we make that environment more stimulating to your brain so your foot stays active? I'm going to put a sensory insole in the shoe. And that's part of why I developed the Naboso insoles. They're textured, right? So just going to talk to you. So that's a way. The other way that you can do it is what you do before you put on the shoes and when you take the shoes off is just as important as the shoes you put on. So it could say, okay, at the end of the day, it's a long hike. You're going to release your feet. You're going to stimulate your feet. This is going to make sure that you are bringing that sensory back to the foot after 10 hours hiking or whatever it is in the cushioned shoes. Right. So we're trying to, how do we find a balance? I'm all about working with people's reality, giving your nervous system as much as we can, knowing that some of these things are part of the reality.
Gotcha. So you had mentioned bunions, hammer toes. Those are all due to improper shoe fit, or is there another factor?
So there are other factors. I am not one to blame bunions on shoes. It is not entirely up to shoes. It really is based off of foot type.
Okay.
So when your foot is unstable, which is usually the flatter foot type. So when you have a fallen arch or a flatter foot, which is called overpronation, kind of collapsing
Mhm.
in, that destabilizes the part of the foot that prevents the bunion from forming. You have these long bones in the foot called metatarsals. And
Mhm.
when you destabilize the foot, the first metatarsal can swing out, and that's what creates the bunion. So it's really a mid foot stability issue that causes the bunion. Bunions are not really big toe problems.
Okay.
That's where the bump is, but the destabilization is more towards the midfoot. Now, where this foot type comes in, because a lot of people will say, "Oh, I got my bunions from my mom," or there's kind of like a genetic kind of conversation around it, is that bunions in themselves are not genetic. The connective tissue integrity is what is genetic. So ligament laxity, having a lot of um, more loosey-goosey ligaments, and your foot has over 100 ligaments. So if you have loose ligaments, then the joint can swing out, creating the bunion. To me, that is a more complete, accurate story of bunions versus saying they're genetic. They're not genetic. They're not on your DNA. You cannot do a DNA test for bunions, right? They're not literally genetic. Connective connective tissue is, and then again, they're not entirely footwear based.
Mm-hmm.
Yeah.
Got it. Got it. Kind of going in that same line of just taking care of your toes. What about toe spacers? I feel like they're just yummy.
Yes, I love toe spacers. I should have one around me. I don't have a toe spacer. I'm always talking about toe
My daughter
spacers.
makes fun of me, but I'm like, my toes feel so yummy.
I love them. I love them. There was actually quite a few people, a famous comedian who did a joke about toe spacers. It was really funny because everyone is talking about them. But
Oh, I
toe
think I know which one
spacers,
you're talking about. It's hilarious.
yeah, right, where he went through TSA and they were like,
Where did
"What is
you
that,
say that
rabbit
it's
holes?" And it was like his toe spacers.
it's toe spacer.
Hilarious. You have to
Yeah.
link it for your
I will definitely have to link that because it's very funny. What is his name's Josh? I think
Josh.
it's Josh.
Yeah,
Yeah.
Josh Jordan or something like that.
Yes. It's hilarious.
So funny. So yeah, so toe spacers, they support natural toe alignment. So you're sliding them on all of your toes at the same time. It's going to stretch and align the toes. So long, straight, and flat. These are good for bunions and hammer toes, plantar fasciitis, neuromas, metatarsalgia. From a I have pain, here's toe spacers. The whole other side, though, is they are an incredible form of recovery. So at
Mm,
the end of the day, throw on your toe spacers. I absolutely love that. After a long hike, throw on your toe
taking
spacers.
my toe spacers and I'm going through
Yeah,
TSA.
you're totally, you're totally gonna love that. And then you can see if they say the same thing to you. So those are great. And then actually for the older population. So as we get older, we are of course concerned with balance and falls. A lot of that has to do with your toe alignment. As we get older, we inherently start to get a little bit of a contraction of pulling in our toes. So toe spacers are actually a balance tool. So that is also how you can mark.
Yes. Can you walk with the toe spacers, do Pilates, those kind of things? Is that a good thing? Walk around the house with them on?
Totally. Yep. In your shoes, walking around, Pilates, yoga. Yeah, yeah. Of course, it has to do with the style. So there's some that are like really bulky. I'll say a brand Yoga Toes. Yoga Toes is a really, really bulky one. So that one you would have to sit on the couch or in the bed and do it. At Nabosa, we sell some that hook around your toes and they're lower profile. So you could use those doing Pilates yoga in your shoes, walking around.
Oh, fun. I love it. I was listening to your videos and looking on your website, and you've had a really interesting, what do I want to say? It was on the Discovery Channel.
Yes.
Yes. I just started laughing. I'm like, of all the things, who would have thought? uh, I don't know, never thought about people's feet. And if you're in forensics and stuff, you can determine height, weight, all those types of things. And you were asked as an expert on the Discovery Channel about Bigfoot.
Uh-huh.
And this is just fascinating. So I want everybody to listen to this because it applies to, just humans in general. But I would love to know how that came about and what is the significance of that?
Yeah. So what just for context for everyone. So yes, I was asked to be on Expedition Bigfoot. I was on 2 episodes and my background before fitness, before podiatry is actually forensics. So I was actually going to go through forensics. So my brain just that's how I look at things is very
Mhm.
mathematical analytical. So when they approached me really as a functional podiatrist, not a forensic podiatrist, they actually did not know that that was my background. And then they're like, "Psh, perfect. This
Yeah.
is like, we could have not planned a better podiatrist to be on it." But they sent me some foot impressions that they found, and I did not watch any episode. I didn't Google anything about Bigfoot, so I could come at it in this total authentic thought process. And so they sent me the imprints, and the imprints, I went through the analysis, and they look very human like in the sense of the plantigrade foot alignment. So you could tell that there was a transverse arch within it. And you could tell that the first metatarsal was aligned to start to create a little bit of a tripod foot. The toes were in an alignment where they could push off kind of, again, human like in that sense. So that was part of the analysis. Then I was looking at the width and the length of the foot, which you can use that to then essentially calculate. This is based off of, you know, thousands of historical correlations to say if you do this and this, that we could predict that your height would be X. And so one of them, I think it was around 9 feet. It was something around the height. I don't remember. It was a while ago that I filmed it, but I did the calculation and I was like, based off of this, I would guess that whoever created this is around, 8 or 9 feet, whatever I said on the show. And they were just like, oh, oh my goodness. Yeah, which is really interesting. And then the second episode, which I loved even more because it had to do with movement. It was less about the imprint, as they had a couple imprints, which means now I was doing an imprint-based gait assessment. And from that, I could actually determine step length and step kind of the width of the gait, how wide the feet were from each other. And based off of the step length is, were they truly bipedal like us? Were they propulsive? So you can stand on 2 feet and pick up your feet kind of like a primate and be highly inefficient and apropulsive. That's kind of like someone with Parkinson's and they shuffle a little bit versus a true human gait with long, beautiful steps. So it was interesting to see that. And then the steps picked up at one point, and that's where I was like, you could figure that one of them was younger. And did they did they carry their child?
Huh?
And then because it was carried and then they continued to step. And then the steps when the little ones disappeared were kind of deeper and more. So it was just like, okay, then the mass of the person, if they picked up the child, really interesting.
Oh my goodness. I don't even know what to say to that. So, everybody's like, is there Bigfoot? I don't know, Dr. Emily, with some feet.
Yeah. I came on and did my gait assessment off of footprints, and which is what a forensic podiatrist does. So I absolutely loved it. And I was like, maybe the world is telling me I should get back into forensic podiatry and do some stuff.
That is fascinating because it's such an important field. I mean, solving crimes and all those kind of things.
Totally. Yeah.
Yes, totally. This has been insanely fascinating. If you were to leave the listeners with one final thing about feet and brain connection, what would it be?
So I would say balance. So focus on your balance, because if you cannot balance on one leg for 10 seconds, which that's the marker by research, that 10-second time is, check. I'm able to achieve a functional duration of balance.
Mhm,
Balance unlocks step length. Step
mhm.
length unlocks walking speed. Walking speed is how you activate the circulatory pump to get the brain derived neurogrowth factor to the brain. Very, very important. So that would be mine, is if you could do a couple minutes of single leg exercises every day. I tell patients when they brush their teeth, stand on one foot for 10 seconds, go to the other side for 10 seconds, just do it 3 times per side. Check.
Yeah, because we're so sedentary. Our society is so sedentary. I'll do my stand up, desk and see my clients and those kind of things. And I'll stand on one leg while I see my clients and I will, see how long I can do that because it stimulates the brain. I don't get as tired, then you drink and you have your amino acids and you have your salts and you have all these things combined. But a lot of it is you just can't sit like this all day long because your feet have to be stimulated and activated. And I cannot wait to get your insoles. I'm going to go order.
Yes, I love it.
I'm so excited. Thank you, Dr. Emily,
Thank
for being
you.
here today. We really, really appreciate you. Fascinating conversation. I know my listeners are super blessed, and I would love to have you on again.
Awesome. I'd be honored to be on again.
Awesome. Thank you, all of you, for listening. I am always honored when you listen. It means a lot to me. So, and what would mean a lot as well is if you would like, subscribe, and share this because so many people have feet issues. So let's share this with everyone. Get everybody walking, moving, get your insoles, get your toe spacers, and all the fun things out there. So God bless you, and I will see you in the next episode. Thanks for listening to Take Back My Brain. If today's episode helped you connect, with hope or direction, I want you to follow the show, leave us a review, and share it with someone who needs it. And if you're ready to start your own healing journey, explore our courses and our coaching programs at lauriehammer.com/store. So until next time, remember, you cannot medicate away a nutrient deficiency, and healing your brain isn't just possible, it's powerful.